Dear students, in this module, we will be covering various policies and programs to mortality decline in a developing country like India. It is very important that how the governmental efforts are making consistently in understanding and also to evolve suitable policies and programs makes a lot of difference in reducing the mortality. In this module, we will cover the various policies and programs that have been designed and implemented by the Government of India over a period of time, so as to mainly with a view to reduce mortality situation. In recent years, there has been increased recognition that reducing maternal mortality is not just an issue of development, but also an issue of human rights. Around the world, governments revamped their policies and programs to give effect to the rights of women to health, equality and non-discrimination. Way back in 1998, about 2.5 million under 5-year-olds died in India, the highest total of any country as brought out by the State of the World Children 2000. The government since then have taken appropriate policy decisions to reduce the mortality rates in India, and which requires our attention. It is important that we have to analyze critically how the response of the policies in reducing the mortality over a period of time, and also the latest which has been depicted in the National Health Policy of 2017 is a very interesting. For example, the National Health Policy of 2017 has clearly brought out that in the area of non-communicable diseases, it recognizes the need to halt and reverse the growing incidence of chronic diseases. The policy recommends to set up a National Institute of Chronic Diseases, including trauma, to generate evidence for adopting cost-effective approaches and to showcase the best practices that exist in the country. Screening of oral, breast and cervical cancer and for chronic obstructive pulmonary diseases will be focused in addition to hypertension and diabetes for reduction of morbidity and mortality. To reduce premature mortality from cardiovascular diseases, cancer, diabetes or chronic respiratory diseases by 2025, to bring it down to 25% is one of the policy aims. In the area of communicable diseases, it is very important to see that the policy recognizes the interrelationship that exists between communicable disease control programs and public health system measures which are required to strengthen over a period of time. This could be through network of well-equipped laboratories backed by tertiary care centers and enhanced public health capacity to collect, analyze and respond to the disease outbreaks. In the case of control of tuberculosis, the policy acknowledges HIV and TB, co-infection and increased incidence of drug-resistant tuberculosis as key challenges in the control of tuberculosis. The policy calls for more active case detection with a greater involvement of private sector, supplemented by preventive and promotive action in the workplace and in living conditions. In the area of HIV or AIDS, while the current emphasis on prevention continues, the policy recommends focused intervention on the high-risk communities and prioritized geographies. There is a need to support care and treatment for people living with HIV and AIDS through inclusion of first, second and third line antiretroviral, Hep C and other costly drugs into the essential medical list. In the area of leprosy elimination, the aim of the policy is mainly to carry out leprosy elimination, the proportion of grade 2 cases amongst new cases to become the measure of community awareness and health systems capacity, keeping in mind the global goal of reduction of grade 2 disability to less than 1 per million by 2020. Accordingly, the policy envisages proactive measures targeted towards elimination of leprosy from India by 2018. The vector-borne disease control is another area which policy specifies. It recognizes the challenge of drug resistance in malaria, which should be dealt with by changing treatment regimens with logistic support as appropriate. New national program for prevention and control of Japanese encephalitis or acute encephalitis syndromes should be accelerated with a strong component of intersectoral collaboration. The mental health which is increasingly coming up in a modern society, there is a recognition in the policy which clearly says that the policy will look into consideration of the provisions of the National Mental Health Policy of 2014 with the simultaneous action on the following fronts, like increasing creation of specialists through public financing and develop special rules to give preference to those willing to work in public systems, to create a network of community members, to provide psychosocial support, to strengthen mental health services at primary level facilities and leverage digital technology in a context where access to qualified psychiatrists is difficult. If we look at the decline in maternal mortality over a period of time, for instance, between 2010 to 2012, over 2007 to 2009, there is a significant reduction that is noticed in a country like India. For instance, when maternal mortality rate was 178 now, which has come down from 212, a fall of about 16%. And furthermore, when we talk about state-wise data, it is very clear that in empowered action group states and a state like Assam, which was as high as 308, which has come down to 257, to the constituting of 16%. In the case of southern states, the reduction is from 127 to 105 to the extent of 17%. In other states, the reduction is from 149 to 127, constituting 15%. In the area of infant mortality, another important indicator of mortality, we can see that in India, the decline was to the extent of 30 points. For instance, in rural, infant mortality rate was 31 points, whereas in the case of urban, the reduction is 16 points. In the last 20 years, at an annual average decline of 1.5 points. So, infant mortality is a very critical indicator which depicts the overall development of the country and also is a very sensitive indicator that provides the overall health infrastructure and also overall mortality situation that exists in any particular society. That is why if we look at infant mortality in India, it has registered a 3 points decline from 53 to 50 in 2008 and has come down to further to around 40 in 2015. The maximum reduction in infant mortality rate in Madhya Pradesh is noticed from 67 points and a minimum of infant mortality in Kerala was 12, which has been noticed. Similarly, Kerala and Tamil Nadu have achieved the MDG target of 28 by 2015. Similar is the case with under 5 maternal mortality rate. Under 5 mortality rate as estimated in 2009, the highlight shows that under 5 mortality rate for the country has declined by 5 points, which over 2008, which was 64 in 2009 as against 69 in 2008. A uniform decline of about 5 points is noticed in male and female under 5 mortality rates. And furtherwise, if we analyze the data from states, it is shown that the maximum of under 5 mortality rate is noticed in the state like Madhya Pradesh as high as 89 and a minimum is noticed in Kerala as low as 14. The government of India, as in the case of most of the developing countries, given the high mothers and child mortality, they have started very intensively the new commitments to improve the maternal and child health programs. The National Rural Health Mission NRHM, which was evolved by and implemented by the Government of India, has clearly aimed at reaching poor families with essential health services and also committed to nationwide expansion of the massive preschool education and child nutrition programs delivered through Integrated Child Development Scheme are noteworthy to mention here. When we look at mothers and children, they are not only constitute a large group in India's population, but they are also vulnerable or special groups. They comprises 71.4% of population of country. Women of childbearing age 15 to 44 years constitute a quarter, that is 22.2%, and the children under 15 years of age roughly constitutes 35.3% of the total population, and thus together they are 57.7% of the population who constitutes mothers and children in this country. Maternal child health, which refers to the promotive, preventive, curative and rehabilitative health care for mothers and children, child health, family planning, school health, handicapped children, adolescents and health aspects of children in special settings such as daycare facilities, all constitutes under the purview of maternal child health program. The maternal child health services objectives are mainly to promotion of physical and psychological development of the adolescents within the family, promotion of reproductive health program, reduction of maternal, perinatal, infant and childhood mortality and morbidity. With these objectives, there was a major cadre who have been created under National Rural Health Mission is a accredited social health activists, popularly known as ASHA workers. One of the key components of National Rural Health Mission is to provide every village in the country with a trained female community health activist, ASHA. The ASHA are trained to work as an interface between the community and the public health system. The key components of ASHA are that ASHA workers are mainly be a woman resident of the village in the age group of 25 to 45 years. She should be a literate woman. The capacity building of ASHA is being seen as a continuous process. ASHA also to undergo series of training episodes to acquire necessary knowledge and skills. The National Rural Health Mission with a major objective is to seek and to provide universal access to equitable, affordable and quality health care which is accountable at the same time and responsive to the needs of the people, mainly in the reduction of child and maternal deaths as well as population stabilization, gender and to attain demographic balance. The major objectives of the mission are mainly in reduction in child and maternal mortality, universal access to public services mainly for aspects like food and nutrition, sanitation and hygiene, universal access to public health services with a special emphasis on services addressing mainly women's and child's health and universal immunization programs, prevention and control of communicable, non-communicable diseases including locally endemic diseases, access to integrated comprehensive primary health care, population stabilization, gender and demographic balance, revitalize local health traditions and mainstream Ayush. Parallelly, in addition to National Rural Health Mission, there is also National Urban Health Mission, which has a sub-mission of National Health Mission, which has been approved by the Cabinet way back in 2013 on 1st May. National Urban Health Mission envisages to meet healthcare needs of the urban population by making available to them essential primary healthcare services and reducing their out-of-pocket expenses for treatment. National Urban Health Mission would endeavor to achieve its goal through need-based, city-specific urban healthcare system to meet the various diverse healthcare needs of the urban poor and other vulnerable sections of population, to institutionalize mechanism and management systems to meet the health related challenges of a rapidly growing urban population. Also, to partnership with the community and local bodies for a more proactive involvement in planning, implementation and monitoring of health facilities, availability of resources for providing essential primary health care to urban poor, partnerships with NGOs for profit and not for profit health service providers and other stakeholders. Also, emphasis have to be mentioned in regard to RCH program, Reproductive and Child Health program, which incorporated the earlier existing programs like National Family Welfare Program and Child Survival and Safe Motherhood Program, and added two more components, one relating to sexually transmitted diseases and other reproductive tract infections. This program was formally launched way back in 1997 on 15th October. The objectives of RCH program was mainly to reduce maternal mortality and mortality in general, reduction of infant mortality and infant morbidity and mortality, reduction of under 5 morbidity and mortality, promotion of adolescent health. What are the highlights of this program? Highlights are integration of all programs related to fertility regulation, maternal and child health and reproductive health. Services are client oriented, demand driven through decentralized participatory process and target free approaches, upgradation of facilities, creation of first referral units, provision of specialist services for STD and RTIs, provision of outreach services for vulnerable groups of the society. The various programs and policies to reduce mortality are to be discussed, which are on priority for the Government of India. To begin with, National Ambulance Services (NAS) is proposed and implemented with a view to emergency services that are dedicated to improve the care provided to the patients, to provide faster access to care, out of hospital acute medical care, medical transport to patients, emergency patient care, and approached and addressed in a holistic manner. At the time of launch of National Rural Health Mission in 2005, such ambulance networks were non-existent. 108 is predominantly an emergency response system primarily designed to attend the patients of critical care, trauma and accident victims. In addition to that, focusing through Integrated Child Development Scheme is very famously known as ICDS program, which is in India. It is a primary response to the nutritional and developmental needs of the children, especially below 6 years, to pregnant women and nursing mothers. It is implemented through a network of over 1 million village level Anganwadi centers. ICDS has witnessed during the last 3 decades of implementation that there remain some major challenges with regard to high burden of child malnutrition in the country, and to address those issues, ICDS program is working in a significant way. ICDS is also committed to reducing infant and child mortality and improving maternal health outcomes. The major 6 service deliveries through ICDS are supplementary nutrition, immunization, health checkups, health and nutrition education, referral services and non-formal preschool education. Through these services, it is tremendously addressing in the various states of India, so that the child nutrition component, child's preschool education component, mothers' health campaigns for them and also their health education are significantly addressed. The other program at national level is the National Program for Prevention and Control of Cancer, Diabetes, CVD and Strokes. NPCDCS is a program which has 2 major components, like one cancer, the other one is diabetes, CVDs and stroke. These 2 components have been integrated at different levels as far as possible for optimum utilization of the resources. The various activities that exist at state, districts, community health centers and subcenter levels have been planned under the program and also very closely monitored through NCD cell at various levels. NPCDCS aims mainly to integrate NCD interventions in the NRHM framework for optimization of scarce resources and provision of seamless services to the end customer or patients, as also for ensuring long-term sustainability of interventions. The other significant control program which we need to address here is a National AIDS Control Program. The National AIDS Control Program, which was launched in 1992, is being implemented as a comprehensive program for prevention and control of HIV or AIDS. Over time, the focus has shifted from raising awareness to behavior change, from a national response to a more decentralized response, and to increasing involvement of NGOs and network of PLHIVs. The other program is a revised National Tuberculosis Control Program. As per the National Strategic Plan from period of 2012 to 17, the program has a vision of achieving a TB-free India and aims to achieve universal access to TB control services. The program provides various free of cost quality tuberculosis diagnosis and treatment services across the country through the government health system is also bringing significant results. The other national program is National Leprosy Eradication Program, NLEP, which is a centrally sponsored health scheme of the Ministry of Health and Family Welfare, Government of India. While the NLEP strategies and plans are formulated centrally, the program is implemented by various states and union territories. The program is supported as partners by different agencies like World Health Organization, the International Federation of Anti-Leprosy Associations. The other program which we need to refer here is the National Vector-Borne Disease Control Program. NVB-DCP is a central nodal agency for the prevention and control of various vector-borne diseases like malaria, dengue, lymphatic filariasis, Kala-Azar, Japanese encephalitis and chikungunya in India. It is one of the technical departments of Directorate General of Health Services, Government of India, which looks into these programs. In addition to that, there are regular programs which are newly devised and also brought out for various activities and programs like Beti Bachao, Beti Padhao Yojana programs, which are mainly targeting girl children and bringing quality of life for the children, so that once these children programs are emphasized and implemented, it brings various tremendous reductions in the Government of India programs as they aims to greater generation of greater awareness and improving the efficiency of various welfare services which are intended for girls. In addition to this, we also should see what are the various strategies employed to successfully carry out these schemes, or that they have to be implemented in a sustained social mobilization and communication campaigns to create equal value for the girl child and also to promote her education. To place the issue of decline in CSR or SRB in public discourse, improvement of which would be an indicator for good governance, and then focus on gender critical districts so that all the districts will address equally and unilaterally so as to see that the results are across the country or state as a whole, so that each state will have a gender equality. In addition to that, we need to know that the various programs and policies are to be regularly monitored and also critically evaluated at the end of each of this period. One of the important aspects which we need to know is, though there are various policy programs and also schemes that are implemented, at a implementation level there is a huge gap that exists between creating awareness among the people so as to utilize them and to see how best they can optimally utilize, so that there will not be any wastes in the implementation. If we look at various evaluation schemes of the various policies and programs, it is very clear that the monitoring of these programs is a major challenge. No doubt, these schemes are very effective when we are highlighting through various media and also to bring out its actionable aspects in the communities, but we have to keep in mind that there are so many things which we need to address. For instance, when we are talking about its implementation, there is a huge gap that exists in this regard. We need to know this.